Today we are coming to you from the East MunicipalHospital. This 100-bed facility was set aside for treating of COVID-19. We've come here to assess what the situation looks like. Ghana's active case count now stands at 530. The numbers were in their thousands previously, and we came here, spoke to patients. It was a very busy place. Is the situation still the same? So join us as we go in there and speak to administrators. We'll try and speak to some patients and speak to some frontline health workers as well to find out how the fight against COVID-19 has been here at this facility. I'll be speaking to the head of clinical department here at the facility, and she will paint a picture of what the situation here looks like now. Let's have a quick conversation with her. Can you tell us, this place used to be very busy in the early stages of COVID-19 between April and June. What's the situation here like now?
Okay, so for the month of September, so far we have received 625 patients, but out of the 625, 621 has been discharged. It means that now, as we are talking here, we have only patients admitted on ward there. So out of this total of patients, 46 has come from airport. So those people that have tested positive on their country, but on arrival here, their test has become positive.
All right, so let's walk through the facility so you give us a feel of what the situation used to look like and what it is now.
Okay.
All right, so
yes.
where do we go to?
First, we are going to the OPD. Okay. That is where we are receiving our patients for checking. And in case that they are showing any symptoms or have any concern, they can come here. We have 2 doctors so far here. Okay. And then we assess our patient and see the way forward.
So we'll be going through, this is the OPD. So when the patient comes, do they have to show any sign or sheet or paper that they were here?
Yes, they have their discharge sheets. So they come here, and then this is the nursing station. She is the one who received the patient and then assess the patient in the first instance and direct them to the doctors on duty.
So for most of them who come here, is it that they are having a reoccurrence or they are experiencing something that they think is post-COVID related?
Yes, most of them.
Doc, so tell me, what does the numbers when it comes to staff strength look like now? The number of doctors you used to have and what you have currently?
Yes, at the beginning, our team of doctors was very big. We have doctors from Kolebu Teaching Hospital who came to support us here. Right now, most of the doctors have gone back to their hospitals, and it's just some of them that are still supporting us and the recovery area here.
We'll now make our way out and see what the environment looks like now compared to what it was previously, where my colleague Umaru Sanda Amadu came here. Still at the East Hospital, you can see clear demarcations. The area you see now is for patients. To my left, that is where the doctors and nurses are. The place is relatively calm, quiet now, so peaceful, very serene atmosphere. Unlike what used to be the case months ago, where you could see them playing Ludo, they were chatting among themselves, sitting outside, and even had some physical exercises or activity. I understand that most of the patients here now are those who tested positive at the airport. So I'll be speaking to one of them to find out where he came from and how the news got to him. Tell us where you came from.
I come from Belarus.
Okay. Okay. And did you have your COVID test from there?
Yeah, I did.
And what was the result?
I was negative.
You were negative?
Yeah.
How many days did you do it before you did the second one here in Buka?
3 days.
3 days?
Yeah.
So were you surprised when they told you that you had tested positive, considering the fact that you tested 3 days before?
Yeah, I was very surprised. I was a bit confused. Let's say I was like, how? But later, talking to them, then the nurses talking to me, and then I just relaxed a little bit.
You've been here for how many days now?
This is my 11th day.
Thank you so much, and wish you a speedy recovery, and hopefully we'll speak to you when you are discharged.
Thank you very much.
So that was a patient here at the East Hospital speaking to us here. Dr. Kisipra is one of the doctors who was at the forefront. She's still a frontline health worker, and she has been here since April, I guess. Yes, April, and she has been attending to COVID patients. So just a brief interaction with her to find out. The place is relatively quiet and calm now. What were the early numbers like? How many patients were you taking care of, like in a day?
In a day. Okay, so usually what we do is we review them every single day, and then in a day we had up to 60. So the average was about 45 patients in a day, and we're usually 2 doctors on duty for a day. And then there were a lot of things we had to do for them. You have to book them for their retesting. You have to run some basic labs for them. You have to review with them, and then tell them what their labs were, because of course they have to know what's up with them. And then we're also doing the discharges based on the 2 negative tests, and so you have to keep track who has 1 negative, who has 2 negative, who can go home, how are they going home, are they going with public transport, are they going with ambulances, calling an ambulance. It was very hectic. It was extremely hectic. So you understand why I like this now. Yeah. So yes, before there was a lot of things that we had to do, but now it looks like things are stable now. Their treatments are now stable. You know what to do. Yes, we know we are discharging them by the 14-day criteria now, and then now I think it's good.
So now you're able to, I'm sure you're able to even tell them by name and who is who.
Yes.
I mean,
Previously it was a challenge because 45 patients, and then they were all wearing masks because we encourage them to, as part of the COVID protocols. Yes, and then you have to know them. You have to know your patients. You know, sometimes someone will come and sit in front of you and you confuse him with someone else, and then you have to keep asking. I thought it was very uncomfortable to keep asking your patients their names over and over and over again. And now there are very few. You know who and who is there. You see them passing. You know, you can identify them easily.
So how many patients are you dealing with now?
Currently, I have 2. On my end, I am managing the mild cases, and then there's the ER. I think that's 1 patient. So in all, we have about 3 today. More can come in.
What will be your advice? Now, people still think COVID-19 is not real. It's still not real.
I have had patients come here with positive tests, repeat positive, and they still don't believe they have COVID because they are asymptomatic. So I think because of the fact that they are asymptomatic, it makes them kind of relax, and it makes everyone else, relax and then let down their guards, which is not a good thing, because we are all trying to, get rid of COVID. Yes, so I don't feel happy. I don't feel comfortable because my numbers could increase easily again. And like I said, I like this situation. I don't want that. So I would admonish everyone to adhere to the protocols, the nose mask, handling the nose mask especially.
Would you say the place is boring now?
Yeah. I would say the place is boring because the environment in itself is very serene. Yes, and then the patients are also fewer, and they are always in their rooms. Like before, they'll come and sit out and then we chat with them. But now everyone is in their own corner, and then we just wait it out until someone needs help or until a new patient comes.
Thank you so much, Dr. Kisipra, and we wish you all the best and congratulations to you and the team as well.
Yes, thank you. Thank you.
So you heard Dr. Kisipra there, and she's been outlining what the place looks like now. Relatively very quiet. I'm now at the administration block, and I'll be speaking to some key persons here in this hospital. They have been at the forefront of fighting COVID-19. How many staff did you have? And we know most health workers across the country tested positive for COVID-19 because they came into direct contact with patients. What was the situation here in the hospital like?
So the secret of East MunicipalHospital is different. So we have hygienists, and that person's role at the dolphin area is to disinfect. You disinfect the staff who has come out from the patient room. You disinfect the inanimate objects or the things. And then the staff himself, you disinfect. Then after you have played your role as a hygienist, you move aside a bit and allow the dolphin instructor to take the role. This dolphin instructor makes sure that he instructs you as to which PPE you should take off first, second and third. So since we started from 21st March to date, we only have one staff who has been infected, and God being so good, 180 staff were managing COVID. But along the line, we had a lot of staff coming on board to support because the caseload were that much. Our highest, I would think, was about almost 90 patients on admission. So we had to manage. They are not just any cases, but we have a mixture of mild cases, moderate, severe, and critically ill patients who are admission. So we had more than almost 190, and then we have only one person who tested positive. God being so good, this person didn't, I will not say got the infection in the facility because she was actually out and she has not resumed to work and she got the infection. And once she got the symptoms, she called. It was tested. She was in the house, managed, and when she was declared negative, she joined the staff here.
Are you worried with the way protocols have not been adhered to currently?
Yes. Now when you pass out, you see so many people without mask. The social distancing, they are forgetting about it. So it's like everybody is doing whatever she feels is good for them and those things. The people are not complying with the protocols at all.